chemo could be before or after. What's the reason for me to order chemo? What would have to be going on for me to bother? Would this be a reason?
No.
No. Good job. Invasive, has to be invasive, metastasis. In other words, beloved, it has to have the potential to spread. It has to be positive lymph nodes, positive metastasis to other parts of the body. Okay, so y'all got it. Radiation. Radiation, remember this about radiation, and it's interesting, I'm leading right into cancer, so we're on target here. Remember this about both chemo and radiation. They're myelosuppressive. What in God's name does that mean? Focus. Focus on the other word.
Suppression. Push down.
What do you think? They're at more risk for
Infection.
infection. Yay! Good job, buddy boy. That's my baby. And y'all forget, just that fast. Gotta teach y'all something every day. What's the A? Anemia. Neutropenia. And thrombocytopenia. What kind of precautions did you give them? Neutropenic and bleeding. Very nice. Now, keep in mind I said that chemo and radiation are going to be myelosuppressive. When we do radiation for breast cancer, we're trying to kill any cells that we didn't get through surgery. Chemo side effects are systemic. Versus radiation side effects are local. Let's chew on that a little bit. If I give you radiation, if I order it, I'm not going to give it to you, but if I order radiation therapy, it's going to be directed wherever the cancer is. If it's brain cancer, it's directed to my head. If it's thyroid cancer, it's directed to my neck. If it's lung cancer, it's directed to my chest. If it's endometrial cancer, it's directed to my pelvic region. Wherever I direct it, that's where the side effects. I'm not going to get a freaking headache if I have endometrial radiation. I'm not going to get UTI if I had radiation for brain cancer. Do you see what I'm saying? It's a local effect. Okay, that's important because the area that it's directed to is going to burn. It's going to dry out. It's going to burn. It's going to chafe. It's going to hurt. Not the day of the radiation, but days later. Again, it's going to burn. It's going to dry out. It's going to chafe. It's going to crack. If it's teeth, they're going to chip. If it's ribs, they're going to crack. It's going to hurt you on the outside and the inside with localized effects. So if I had a lung cancer and I got radiation, I have a very high risk of fracturing a rib. It makes everything brittle, dry, and burned. Inside and outside. Don't forget this word. You've got to know it. You know what I tell you to remember, even though you can have it in the eye? Brachytherapy, just for simple stuff, simple sake. I tell you to remember B for brachytherapy, B for below the waist cancers. And brachytherapy, B for brachytherapy, B for beads. The rest of it don't start with B, but beads is a good one to start with. You could say pills, capsules, wires, seeds, implants, pellets they're called. So bead seeds, rods, pellets, implants, all that kind of stuff. It's implanted into whatever reproductive cancer you have, whether that's a cervical cancer and they're implanted in the cervix, if that's a bladder cancer, they're put in the bladder, if it's anal cancer, whatever. This is for below the waist cancers, and here's the killer part. It's indefinitely radioactive. So you have to stay 6 feet away from the family members, no child care, no pregnant lady, no breastfeeding. Okay, so again, it's radioactive. You have to stay 6 feet away from everybody. No sex, no sharing a bedroom. What else? You have to sit down to use the bathroom. Guys, you have to put the top down to flush, and they have to flush 3 times. Everybody does. But guys usually stand up, they have to sit down. So it's radioactive, okay? And it's usually for about a week. So I had the thyroid radiation, radioactive, okay? So 6 feet away from everybody, okay? And what I tell patients that nobody remembers to tell them, and hopefully you'll never forget, because many of us, especially ladies, we have our little fur balls, and our fur balls sleep with us. They're our babies. In fact, my daughter's fur ball is so rotten, we say that she's breastfeeding him. We hope not, but that's how he acts when she leaves the room. So you could kill your puppy. You could literally kill your puppy or your kitty or whatever you got that likes to climb in the bed with you, because you're radioactive and they're really tiny. And some of these little doggies are purse doggies. They're gonna die. And nobody remembers that, but nurses. So you gotta tell them, get rid of the pets for about a week, get rid of the children, or at least stay very far away from them. You can't be having a baby. And I remember the doctor said, who's ever at this level with you is in danger, because it's right here in my neck. Okay, so brachytherapy. Okay. More cancer stuff. This is the nurse has to be very careful. She only gets 3 10-minute breaks in the room for a total of 30 and 8 hours, and I'll say it again. The nurse only gets 3 10-minute breaks in the room. So 3 separate 10-minute breaks in the room in an 8-hour period for a total of 30 minutes and 8 hours. Okay, so she only gets to be in that room 3 separate times, and each time she's limited to 10 minutes, and then a total of 30 is just to wear a badge. You can. It doesn't do anything for that. No, bleach is for diarrhea and blood. That's for HIV and BCG. HIV and BCG. Okay, so that's fine. I mean, you can put that, or you gotta hurt anything. I think it's a good idea to bleach your freaking toilets anyway once a week. Right. Oh, okay, now let's do our ant, because we gotta do our little anemia, neutropenia, and you guys better not screw me on this, but you gotta actually give me one apiece. So get your life together and tell me what a neutropenic precaution is.
No first ball.
Oh God, I love you. No fresh flowers, keep it moving.
No sick people.
No who?
Sick people? Crowd. Sick people.
What'd she say? Oh, no sick people, I love it. Yeah, stay away from the sick.
No live vaccines.
No live vaccines, name them. Wait, whoa. Hit it. Measles, mumps, rubella, varicella. Woo! No measles, mumps, rubella, or varicella, because what are these? Live vaccines. What's the other word? Attenuated. Don't forget these, y'all. There's another one to add to the list that just don't go with our song. What is it? Who knows it? Anybody? Shingles. Because what is it? It sure does, but it's different. Varicella is chickenpox. Separate vaccine. And herpes zoster is shingles. Yeah, no both. Okay, no sick people, no fresh flowers. Y'all got a million more. Come on here. Wash your damn hands. What's that called on the test? Hand hygiene. Okay, give me more love. TB screen once a year. Not shit. Very good. Yeah, pneumonia and flu. Now, that's a good one. It's for both. That's the only one for both. Why is a soft bristle toothbrush true for neutropenic too? Yeah, because if you have a really hard toothbrush, you're brushing with a really hard toothbrush, you could make your gums bleed, and that's where the bacteria enters and can cause endocarditis. Okay, give me more love. What you got? No fresh veggies, no fresh fruits. Good. No manicures, no undercooked meat, no raw meat. Yes. Y'all jamming? Check temp every day. Condoms, that's what my patient died from, not using condoms. And she had cancer with radiation and chemo, and he gave her gonorrhea, trick, and chlamydia, and she fucking died at 27. Ooh. Yeah, lesson to self, okay? All right, give me more love. No emptying kitty litter. I never heard that, but I'm gonna put it in here. Y'all better add that. No reptiles. Damn, they get fancy. Okay, no birds. They got salmonella. Stay out of your ass, yeah. Yeah, we said that. Remember, we were saying nothing in the ass. That's right. No, nothing. So no suppositories, no funky biz. No smoking, no enemas, guys.
Yeah.
We weren't kidding. Now, why not any smoking, y'all? What's the rationale behind that? Yes, very good. It suppresses the immune system. Remember we said it suppresses it so bad that HPV could take over? Okay, what else y'all got?
No gardening.
Good. No gardening. Oh, doing a damn thing. No pepper, no paprika. Paprika? Why not? Why no peppers and no paprika? They're grown in the dirt. They're grown in dirt. You can spice it up if you want to, and not with that.
Or you have to
For
cook
whatever
them.
reason, this ain't no raw, this ain't no fresh veggies anyway. If you cook it, you're fine. You cook the shit out of it. Yeah, peel it, cook it, boil it, or forget it. That's right. Anything else you can think of? Somebody said no crowds earlier. That was good. No prison. Stay out of Day-Day's damn cell and put some money on his books. Why no prisons though? What's in prisons?
Everything.
Well, yeah. But on your test, what's in prisons? TB. TB is in prisons. Okay, what else y'all want? Oh, good girl. Look at that baby. Prophylactic, antibiotics.
I know.
Before dental work. How soon before? 1 hour. 1 hour, don't be screwed up, I'm talking about a week. Okay, anything else you can think of? I love the temp every single freaking day. Uh-oh, y'all ain't give me no reasons to call nobody. Y'all ain't gonna call me for nothing? Okay, that's better. Call if, it's called call ifs. Call ifs. Flu-like symptoms, what the hell is that? Okay, y'all are aches, pains, what else? Fever, chills, sore throat, what else? Anorexia, fatigue. Sore throat. I think y'all know these. Y'all guys know these. Okay, enough of this. Now, act like you got some sense and do bleeding precautions. Oh, wait, whoa, hold up. Okay, so let's just say that your patient called with some of this hot mess. Remember, nurses, because not all the time are you gonna get technically the doctor's order first, because you have something called a brain. And I wish I would wait. I wish I would, as a nurse, wait until somebody told me to do everything. No, when this patient comes in, you already have a pee in the cup, got a clean catch on them. You've already gotten your little sputum culture done. You got the throat culture. You did stool if there's any diarrhea. In other words, get all that, then the doctor's gonna order it, you ahead of the ball game. You already got it. Especially if the patient only pooped once, then you're like, screw it, you only get that one sample, okay? So again, you know that the proper workup of this patient is going to include, and you can't do this because you're not a radiologist, but it's gonna include a chest x-ray, a urine culture, a urinalysis and culture, a sputum culture, blood cultures ×2, select all. Everything I'm telling them is on their damn NCLEX. That's why Tri-C passes, and they're not a bomb. They don't believe it when they're in the school, but your school is the bomb. Okay, so chest x-ray, urine, stool, sputum, throat, blood ×2, different sites for those. And you have to do all of that before antibiotics, which is why it's so important to get it as soon as they come in. Because you would like to give them their antibiotics as soon as they get it ordered. But then if you got to do all that freaking culture shit, you just did it. Okay. Bleeding precautions.
No flip-flops.
No flip-flops, no flossing. Keep those together. No flip-flops, no flossing.
Soft toothbrush.
Flip-flops means open-toe shoes, right? No G-herbs.
Soft toothbrush.
No feverfew. No, which kind of razors?
You can use
Electric razors are fine. No quote-unquote safety or straight razors. They call them safety razors, don't fall for okey doke. So no safety razors, no straight razors, electric razors only. What other things do you
Soft
do?
toothbrush.
Soft bristle toothbrush.
No invasive.
No NSAIDs, no aspirin.
No invasive.
No invasive procedures, that's our issue. Good. No alcohol, no vitamin E. Anything else? What about the call ifs? Ah, yes. Call us if you have bruising, tarry stools. What is another word for tarry stools?
bloody.
Ooh, occult is good. Elena, occult. Know those both. Call us if you have red,
Pinpoint red spot.
pinpoint dots on the skin. What's that, y'all?
Petechiae.
Okay, good.
Then upper back.
Black schools, tarry black schools, yeah. Yeah. I guess those guys a lot. Okay, what else? Coffee ground illnesses. Okay, so that's your little ant. Now, you have a handout in your cancer packet. It says leukemia. We use it for both lymphoma and leukemia. Somewhere in that cancer packet. hemoglobin or hematocrit less than what?
36.
12 and 36, write it in that space. For, oh shit, there you go, we're playing okay. Okay, now, neutropenia, white blood count less than, ooh, yo, shit. Platelets less than,
150.
oh my God, I love you guys. You guys are doing so good. Remember when I first had shit look all retarded? Okay, so you guys learned it, good. Those labs are what you gotta know. Okay, so H&H less than 12 and 36, white blood count less than 5,000, platelets less than 150,000. But on the platelet issue, we get really worried when it's less than 100,000, and we would have to hold the chemo. So it's not that we're not worried, we just know that you still have the ability to clot at 140, 130. But once you drop below 100, would you agree you probably can't do much with that if you're giving patient chemo, it's gonna get worse, right guys? Now what is the danger number?
25,000.
Less than 25,000, what's the possibility?
Spontaneous bleeding.
Spontaneous bleeding and DIC, excellent, write it. Spontaneous bleeding and DIC. Just out the blue, blood come from everywhere. Okay, now if you look at the actual handout, it says leukemia, of course underneath there we use a little bit for lymphoma. And the only thing you really have to focus on with those, not all that crap you had learned at one point, but the only things you have to really focus on with leukemia and lymphoma is going to literally be ant. That is the focus, so spend the most amount of time on that, get off of that, don't worry about that. Now, you have, and you're gonna need it Wednesday,